Hi, I'm Dr. Sharyl Truty. Welcome to our weekly lunch for your health noon hour talk. I'm owner of Balanced Physician Care. And again, my name is Dr. Sharyl Truty. Today, we're going to be talking about eye health. Um, so a lot of people, have questions. Everybody wants to sort of know, what can I do to keep my eyes healthy? So if you have medical problems and you have issues with your eyes, or you have a family history, I'm sure this is a topic that might be interesting to you. So what we're going to talk a little bit today is about what can you do from a nutritional standpoint to help out your eye. So this is sort of a picture here of your eye. And we're going to talk about these four sort of vitamins or nutrients that are very important for eye health. Most of you have probably heard of them. Vitamin A, beta carotene, lutein, and zeaxanthin. So the first is vitamin A, and the second three are what we call term carotenoids, and those are what we call phytonutrients or plant nutrients that in the body can convert into products that are helpful to the body. Particularly beta carotene, it will be converted to vitamin A. So, just talking about vitamin A and talking about beta carotene first, the way they work in the body for eye health is that they nourish the pigments of the retina. So this is sort of a picture of your eye, and we obviously have your lens right over here and your cornea. And then in the back here, okay, you have sort of a layer of tissue that's called your retina. And that contains the nerve endings or sensories that are involved in sensing our eyesight, sensing color in the world, and pictures. And so these vitamins are important in nourishing that health. Let me bring up this one because this is primarily what we're going to be looking at here today. So let's talk a little bit first about vitamin A. So what most people don't realize is that vitamin A primarily is found in animal foods. So beta carotene is found primarily in plants, and then people have certain enzymes that convert that beta carotene into the nutrients that are needed to help out with the eye. Um, we have preformed vitamin A is absorbed in the body as retinol. And so this is what, again, creates the pigments of the eye. Vitamin A has a lot of other important functions in the body, which we'll touch on in a moment, but as it goes to the eye, it's very important. So foods that are high in vitamin A are liver and cod liver oil, as well as whole milk. So again, a lot of animal-based products. Um, when we're looking often at vitamins on the back of a vitamin bottle like this, one of the things that you want to look at with vitamin A is that you want to look at what type of vitamin A that your supplement may have. It is going to either have, tell you, a good supplement will tell you how much of the vitamin A is preformed vitamin A versus how much of that vitamin A is due to the carotenes, and specifically beta carotene. And the reason why this is important again is that some people don't always convert their beta carotene very well. So again, the plant form of vitamin A is provitamin A, or the carotenoids. So there's a couple other carotenoids, alpha carotenoid and beta-cryptan, as well as beta-carotene. And these in the body are all, again, converted to retinol. But some people's genes can be different, and that can affect their ability to convert this vitamin A. So for people whose conversion is inefficient, they might find themselves with some deficiency, especially if they're vegetarian or vegan and not eating a lot of animal-based products. There's going to be some other carotenoids that we're going to talk about, lutein and zeaxanthin, and we'll touch on lycopene. Lycopene doesn't have a lot to do with eye health, but it is a carotenoid since we're going to talk a little bit about those. So people who are low in vitamin A are going to experience symptoms like maybe having problem again with their vision. They might notice some issues with their skin and conditions besides being that people might find being low in vitamin A. So if you have a low thyroid, you might be concerned about being low in vitamin A. If you've had bariatric or gastric surgery, that's another thing that can lead to low vitamin A. And then people who have GI or functional or malabsorption syndromes, again, might run low in vitamin A. And then people who may have liver issues, specifically liver diseases, may find problems. So again, when we're talking about food sources of vitamin A, primarily, again, we're talking about animal sources, as we mentioned. And a lot of people nowadays with eating lighter meat and a plant-based diet may look at, going ahead and doing some supplementation, particularly, again, making sure they have the retinol. So then as we move to the carotenoids to talk a little bit primarily about beta-carotene. So the foods that we primarily find beta-carotene in, most of us have heard of. Carrots is the big one. Everybody knows that those bright orange carrots and sweet potatoes are high in beta-carotene, but so also is spinach and those dark leafy green vegetables. Red peppers are high in them, as well as apricots, broccoli, and pea pods. If you're interested at all in sort of getting a list, feel free to email us at membership@Balanced Physician Care, and we'd be happy to send you a list of foods that, again, are high in vitamin A and in beta-carotene if you're looking for dietary sources. So now, as far as beta-carotene goes, there is no upper limit of normal. In vitamin A, most people put the maximum level of vitamin A in a day to be around 3,000 IUs or international units. That's what, for most people, is to be considered by the RDA sort of the average intake and what it should be. Children who are 4 to 8, that's about 1,300 international units. And interesting, infants are about at that same level. When you're a little bit older, in the preteen age, we're looking at about 2,000 IUs. So when you're looking at your children's multivitamins, those are going to be sort of the numbers that you're going to be wanting to look at. With beta-carotene, there really isn't an upper limit of normal. So you can eat as much and take in as much of the beta-carotene as you want, because the body is able to sort of, it doesn't over-accumulate in the body where there would be any concerns about too much of the carotenoids. However, there can be a concern of not having enough, again, because of that conversion ratio. For people who are, for the conversion ratio, it kind of really depends on, the type of beta-carotene you're eating. And so that conversion ratio, if you actually have vitamin A, that conversion from beta carotene to a retinol can be somewhere around anywhere from 24 to 1 to 12 to 1. So in other words, it takes sort of 12 times the amount of beta carotene to convert itself down into the retinol that can be absorbed by vitamin A. So again, you're looking at wanting to really increase your amount of beta carotene if you're looking at eye health, and looking at those foods that we mentioned, again, carrots, spinach, sweet potatoes in your diet. And again, when you're looking at a multivitamin, you're going to be, again, looking at vitamin A. You're going to be looking at how much is retinol based and how much is from the carotenoids or beta carotene. And you want some, it'd be good to have some of that vitamin being pure retinol palmitate or vitamin A, and some of it being carotenoid. Again, making sure that the the vitamin A is not too high, because vitamin A, I don't know if most people can realize, there can be toxicity to too much vitamin A. So again, not to too much beta carotene, but to vitamin A, there can be toxicity. Toxicity or too much vitamin A symptoms can be fatigue, headache, joint pain, muscle aches, or dry skin. So again, you want to try to stick to, unless you have physician guidance, a level of the retinol and retinol palmitate around that 3,000 mark. So now, for medical issues, for people who are dealing with specific medical issues as it relates to, again, that pigment or that retina, from a medical standpoint, as physicians, we might go ahead and recommend higher levels of vitamin A. Dosing for medical can be about 2,500, so 2,500. 25,000 IUs. So 25,000 to 300,000 IUs have been used in certain medical conditions. But again, I would recommend talking to your holistic or functional medicine provider before doing something like that. For yourself, again, looking somewhere around that 3,000 to 5,000 range for vitamin A in your supplementation is usually good. You might be able to go as high as 10,000, but I think a mixture of 5,000 of vitamin A and a mixture of the carotenoids is going to be important. The other fact about the carotenes is they're also very important in immune function. So again, another reason. So kind of summarizing, what I would tell you, again, bottom line is vitamin A found in a lot of animal-based products. Beta carotene, again, a lot of your plant-based orange-colored foods, but leafy greens as well. If you're looking to do supplementation, beta carotene, you can certainly supplement as much as you would like. With vitamin A, you kind of want to try to stick to a more conservative range, again, to avoid toxicity. All right, so let's go on and talk a little bit about a couple other carotenoids that are involved in eye health, and that's lutein and zeaxanthin. So lutein and zeaxanthin, again, are dietary carotenoids, and they go to the, again, macular region of the retina, and they help to filter the blue light of the sun. And so the actual dosages of these is unknown. So that can often be difficult because we're still trying to figure out in medicine what those dosages would be. So when you look at your vitamins, you're going to probably see a sort of estimated dosage that, companies have sort of come up with as what people need. But obviously getting these carotenoids from your food is going to be optimal. The foods that have these in it are going to, again, be your leafy greens, so your spinach and your kale. But it's also going to be found in the yolks of eggs as well as grapes. So both of these foods are going to be high in those, both of these plant carotenoids are going to be found in those foods. So, there's been some trials with some different dosages for certain, again, macular issues. And I would talk to your functional medicine or provider. Certainly, you can come in here for a consult and we can talk about levels and dosages as they would relate to certain medical conditions. And so, lastly, let me just really quickly talk about lycopene. So lycopene is a carotenoid, but it really does not primarily have a lot to do with eye health. So that's why I didn't put it sort of on our list today, but it is a carotenoid. Since we're talking about beta carotene and we're talking about lutein and xanthine, kind of, want to throw lycopene in there. Most people know lycopene is primarily found in tomatoes, and it is found, in sort of those red-based foods. And what lycopene does is it quenches free radicals. There's no known daily value that's optimal. Dr. Weil usually recommends about 15,000 IUs. It's not considered an essential nutrient, but I think studies are obviously showing that it can be very powerful at preventing free radical damage. And free radical damage can cause problems with heart issues and nerve issues, and certainly lots of different types of cancers. So trying to keep your dietary dosage of lycopene high is good. Again, not so much specifically as it relates to eye health, but in general. So we talked a lot about these pigments, and again, these pigments have to do with helping the retina and seeing, but there are other conditions of the eye that people often deal with that have more to do with the vascular or the blood vessels and how they affect the eye. So of course we have, this sort of layer of the retina, which has our sensory nerves, but we also have blood vessels, okay, that are very intimately involved in the eye. And so people can develop medical problems like diabetic retinopathy and other types of blood vessel issues that can affect the eye. So that's, a little bit different than just talking about the sense of seeing. This is sort of talking about sort of the blood vessels that nourish the eye. And so there are certainly some vitamins that can be helpful in foods in that. So, and those are going to be anything that you would consider, for the most part, to be helpful for vascular, cardiovascular, blood vessel health. Specifically, as the studies have sort of looked at diabetic retinopathy, CoQ10 seems to be playing a very important role in keeping that eye vessel healthy, as well as magnesium. Low magnesium seems to sort of constrict the blood vessels. And so making sure you're getting enough magnesium. Zinc reduces oxidative stress. And so making sure you're getting enough magnesium. And then the purple pigment plant or fruits are going to be very important. So purple pigment is going to be your grapes, your blueberries, your blackberries. Those have high in what we call anthocyanins, and those are very important, again, for health. For some people, obviously diet is optimal, but if we can't really seem to feel we get those optimally, there are definitely lots of different supplements that can be helpful. And then getting a good dose of fish oil. I'm a big believer, if you can't eat 3 servings of wild salmon a week, then looking at taking a good high quality fish oil supplement can be very helpful for eye health. So those are sort of kind of a general overview of diet and nutrition good for eye health. Again, primarily we talked a lot about vitamin A and beta carotene. Those are the cornerstone of dietary eye health. And then lutein and zeaxanthin are also emerging as carotenoids that are very helpful. Again, vitamin A sources are primarily going to be animal, and beta carotene sources are going to be plant-based. And you do have to be careful, though, with vitamin A of not having too much toxicity. That's probably primarily found when people are supplementing and not as much with dietary sources of vitamin A, because again, it's animal based and there's sort of a select sort of amount of vitamin A foods that have that type high amounts of vitamin A in them. And beta carotene, one of the cautions always with beta carotene is just to be careful if you're a smoker overdoing it. There are some concerns with that, but otherwise, getting beta carotene from your foods is great. And then we talked about lutein and zeaxanthin, and all these carotenoids again are going to be found in your orange pigmented and your leafy greens. So that's a little bit on eye health. Certainly, if you have any questions, feel free to let us know. If you're interested, again, in getting sort of a list of foods that are high in these, please go ahead and email us at membership@Balanced Physician Care. Again, I'm Dr. Sharyl Truty. I'm owner of Balanced Physician Care here located at the beaches in Jacksonville. And be happy come to check us out at our website, balancedphysiciancare.com. We do primary care, holistic medicine, as well as acupuncture and sports medicine. So thank you for tuning in again at our lunch hour chat. Next week, I'll be taking a break, but we'll be back the week after, which would be August. Sorry, I am 1 week ahead of myself here. So we'll be again going doing our Facebook Live chat next Thursday. And then the week after that, we'll be taking a little bit of a break. So please, again, tune in next week on the 16th. And we'll be talking about healthy fat, a topic that I think often has a lot of confusion around it. So we have our schedule of our Thursday noon lunch talks up on our website. And once again, I'll see you next week, and we'll skip the following week, and please check us out. Take care. Have a great day.